It's Dr. Lander here at Advanced Animal Care in Richmond, Kentucky, and today I'm going to be talking about everything you need to know about cat pain management.
So, Dr. Lander, how will I know if my cat is in pain?
Cats are pretty stoic animals as a whole. Maybe dogs, if you're more used to them, they may show pain a little easier. Cats, though, they're, like I said, stoic. So what they'll oftentimes do if they're in pain or there's some abnormalities, they'll hide. So hiding is a great way. You know, if they're usually very social, that's a great way to kind of assess whether or not something's up. Vocalization, changes in urination, maybe they're not eating and drinking, etc.
Why is it important to avoid self-diagnosing pain in your cat?
So self-diagnosing pain in your cat can not only kind of increase their pain, let alone maybe damage something more, whether it's maybe like a fracture or they have severe GI upset. We don't want to be pressing on their stomach at home, as well as you could get hurt. Cats, they have teeth, they have claws, and they can hurt you with those.
So how will a vet know if my cat's in pain?
So depending on what the suspected issue is, that's where a good history from you as an owner is really important. Maybe it's like a bone issue or a joint hurts and they're not walking around or running as much. We can manipulate certain joints and move them more and decide whether or not that's the issue. Maybe there's a GI upset, GI signs at home, we can feel the tummy, etc.
What are some possible conditions that cause cat pain, and what are some of the pain treatments?
Yeah, so cats, even as they get older, they can get osteoarthritis. So a treatment for that might be non-steroidal anti-inflammatory drugs, usually a pretty short course of those nonetheless, just to help reduce that initial inflammation. Maybe GI signs. Cats can get something like IBD, inflammatory bowel disease. That might be treated with gastroprotectants. Maybe there's vomiting and diarrhea involved, antibiotics, etc.
So what types of pain medications might a veterinarian prescribe for my cat?
Kind of hitting that again, non-steroidal anti-inflammatories, especially if it's like joint or bone involvement, whereas maybe if there's a GI component, we don't want to use anti-inflammatory drugs for that, so something like gabapentin would be good.
What is the most important consideration when it comes to cat pain management?
So cat pain management, especially if maybe we're talking about more of a geriatric cat, is can it be managed, let alone ideally treated? And if it can't, we may have to consider quality of life, and overall maybe a humane death might be the best for them. However, if we can, we're going to try to manage it and treat it best we can.
All right, thank you so much.
Thank you. Give us a call if you need anything.